All right, team, welcome back to Plastic Surgery Untold. We actually have a special edition today that's going to be brought to you by Austin's most beautiful man, Gilberto Sainz. So I am going to hand over the mic and the lead to one Gilberto Sainz. Please take over. Austin Plastic Surgeon, passing over to one aesthetic PA, Gilberto Sainz.
The passing of the torch. I'm honored.
Well, let's see it. Let's see it. Let's see what our ratings go.
Let's see what happens. Thank you for having me here. I'm really excited about this episode.
Well, you having me because this is your show today.
Oh, yeah. Well, thank you for joining me.
I appreciate the invite.
We've gone completely off the rails, folks.
It did not take long at all.
I am here with my celebrity cast. One Dr. Johnny Franco, also known as Austin Plastic Surgeon. One celebrity anesthesia to my left here, also known as Travis Osborne.
Thank you, guys.
And straight from the suburbs of Hutto, Texas, Mr. Donald Harris himself.
The one and only.
I'm so glad that 2 weeks after the snow apocalypse, you could get out of your driveway. I know you were worried you'd bought some chains and some other things for your car. So I appreciate you making it. I know you were running late because
it was
the Sunday traffic in Austin was really hard for you.
It was a tough drive. It was a tough drive, but it's the dedication that brings me here. That's what it is.
What I appreciated the most was that you took the time in the balmy 70-degree, afternoon to strap those chains on just in case.
And then to text us during a podcast to let us know that you're going to be late. That way we could make sure to be interrupted while you were trying to
hold on, special guest. Let me check this text real quick. Oh, wait, no. It's just
don't worry, Donald will be
our
here.
fourth is going to be here in a little bit.
Sorry, Dr. Buford.
Not on mute?
Sorry, Dr. Buford.
But we have this concentration level. It's like a Jedi, conserving the power of the Force, and you're trying to break it, but we didn't let it. We pushed through.
We did.
We
managed.
Until I came into the studio and started talking loud.
Despite Donald being like the Sith, the evil bad guys, with his like purple lightsaber. But please continue.
Oh, thank you. I appreciate it. So, well, before we get started, why don't we see what everyone's been up to recently? Dr. Franco, you wanna let us know what's going on with your practice, or?
No, life's been good. I had my mom here for the last 2 weeks. Little Winston gained about 20 pounds. When you're only 20 pounds, that's a lot. He doubled his body weight because she made him chicken 4 times a day. I told him he only eats twice, but didn't really matter. He was hungry.
I can come over for dinner.
Yeah. So other than that, things are good. Practice is rocking and rolling. We got hopefully a few new announcements coming in the next 2 or 3 months that I think will be really, really big. Other than that, you know what? I was elected president of the Austin Plastic Surgery Society.
Oh, wow.
So
Nice.
So appreciate that because it was fellow plastic surgeons here in Austin. So thank you to anyone who listens. Appreciate it. And now I'll probably try and gather up some of these guys to be guests at some of the meetings.
That's a huge honor because it comes from your peers, right?
It comes from my peers.
That's awesome.
Well, thank you.
Yeah, congratulations.
Recognized game.
Yeah. Celebrity anesthesia. Man, what's going on with you?
Just been busy. Last week, I talked a little bit about the snowpocalypse in the previous episode and dealing with that. Honestly, from a professional standpoint, it was a lot of re-engineering our schedule, and we missed about a week of cases. So getting plugged back into a couple of those cases and finding out days that we could make up on weekends and stuff. So just a lot with the business, balancing, QuickBooks. I'm wearing 15 hats at this point: accountant, registrar, consultant, everything. So, but it's been good.
Can I ask you a question? You didn't mention your wife on the last show, so she's gonna be upset that she didn't get a plug at your attorney therapist. I actually saw her on the gram last night. You're rubbing off a little bit on her because the outfit she was wearing was a little risque. I'm not sure how she didn't get flagged on Instagram. If she did, it wasn't me.
It was. I will start by prefacing this.
My mom was looking over my shoulder. I was like, "Oh, take that down."
I think all the parts that have to be covered were covered. Okay. So in her shirt, went out for sushi last night. I was gonna save this for next episode. Actually, I'm gonna tease you with it. We had an issue at sushi last night.
Oh, so they gotta wait till next week to hear about it.
They gotta wait till next week to hear about it.
So you're gonna have to tune in.
Yeah.
You know,
Well, my wife at Your Trendy Therapist is going to be on our next show for next week, and I'll tell the story.
Okay. Okay.
I like it.
All right.
Right on.
Donald?
Yeah, man. Been pretty busy, obviously. Like you guys suffered the good old snowpocalypse. Had a really good talk. Again, in the gaming industry, so everyone. I'm more focused in the games
And they
industry.
can actually go on your website and sign you up for a talk.
They can. It's
Limited availability, so you gotta like really
Get
scroll
in there
through. Don't
fast.
get disenchanted.
So-
Lots of people want tall gamers, so just because your day one isn't there, come with 5-6 different options. Plan ahead. Plan ahead.
The overall joke here is that someone is just jealous that I have a great website. So yeah, if you definitely want to talk about games or diversity in games, definitely give me a holler.
But it's not
Donald-
just games. I thought you talk about diversity overall.
Yeah,
'Cause
it's-
you've been hired by people not just in the gaming industry. Because I don't want people to pigeonhole you. You're not a one-trick pony.
That
No,
is
no, no.
that is true.
Okay.
And actually, the next talk that I have coming up is at Texas A&M about diversity and inclusion. So yeah, you're absolutely right. But
That's awesome.
if you are interested, definitely head over to donald-harris.com and sign up and let's meet. Let's talk. So yeah.
I like it.
Very nice.
I like it.
Very nice.
So,
What about you, man? What's new with you?
what is going on with me? Recently, just like everyone else was having, all these issues, just finally getting back to a normal life. I spent a couple days, about a week, with my parents back home in South Texas.
Oh, nice.
A few weeks ago, before
is it
before
true
the
that your
snowstorm.
mom helped you fill out your new Tinder profile? Because that's what was word on the
That's-
street.
that-
I just want to know if
I-
there's any truth to that or not.
I
Because
thought we were saving that for fact or fiction.
oh, okay, I had heard this. I wasn't sure. I just was trying to find out whether this was true or not. Because that would be absolutely phenomenal if this is true. Ladies, I mean, you get it straight from Mama Gilbert.
Yeah,
So boom,
yeah.
boom, boom.
It's her little side hustle.
Okay. Okay.
So if anyone needs help with their Tinder profile, hit her up. at-
Donald?
Hey,
Headed your way.
Yeah. Well,
exactly. I got the pictures already.
can we jump into
Yeah,
little
let's-
action?
let's
What's
do
going
it.
on? Because
Let's do it.
what do we got going on today?
So today we're talking about injectables and new exciting stuff that's coming in 2021. I took some time this past week to prepare this little podcast for us, and reached out to some of the people in the different injectable companies and try to get some information on stuff that's coming up, what we're going to be looking for and looking forward to in the future.
Look at you, man. Some behind the scenes sneak
Research
peeks.
Yeah.
and
Love
hard
this.
work.
Yeah.
Well, Gilberto had the idea. It's kind of been 2020 wasn't great for most people. 21 hasn't started out like we had hoped, and he's like, you know what? Let me turn that frown upside down
Yeah.
and bring some sunshine here. And so he thought, what's all the exciting stuff that's coming in 2021 for people to look forward to? And so found a list of some really good stuff. There's some really, really exciting things coming, and some are coming soon,
Yeah.
really soon.
Yeah.
And some have arrived.
Yeah.
Boom, kick
Can we,
us
can we,
off.
can,
Let's
we-
do
can we
it.
talk about one?
Yeah, let's make
This-
some magic
I'm
happen.
I'm super excited about this one. This is a product that's going to be released here probably at the end of Q1, spring of 2021. It's a product called Quo, and it's used to treat moderate to severe cellulite in adult women.
You're worried for Speedo season because we're
Yeah.
going to Miami in April. And
Yeah.
so I see why you're worried about the time crunch
I'm
there.
super excited.
I actually got my first training session with them in 6 days.
Oh, nice.
Oh,
6
very
days.
nice,
So
very nice.
coming soon. Yeah.
So
I
now-
don't think I even told you that.
No, you
wait,
didn't.
You're welcome.
when we're talking about treating cellulite, so like previous to this, I've always thought about like removing fat and removing the cellulite. How does this?
But
this
that
work?
that
so
may or
that-
may not be true.
Uh-oh.
Yeah.
Uh-oh.
I think there's a little misconception there because
Which a lot of people have. Thank you, Donald, for bringing this up.
yeah. So
Contributing right there.
yeah. So cellulite is.
I hope you guys are watching on YouTube as well because this is I'm not sure what's going on
A
here
lot
in
of
the studio
faces are
right
being
now.
made.
But please.
Correct me if I'm wrong, Dr. Franco, but cellulite is a combination of a couple different things. It's the fibrous tissue of the skin pulling down and tethering the skin, along with certain fat distribution in pockets in certain areas, more commonly behind the thigh and buttock area.
Yeah, and that's because it becomes a very, very, very difficult area to treat because especially in this day and age, a lot of people don't want to take fat out of their butt. And just because you remove fat doesn't mean that you remove that tethering. And you got to be super careful because sometimes lipo, especially in the thighs, can actually make stuff
Get
look
worse.
worse. And the thighs is one of these. I'm not saying you can't do it. We do it, but you got to be super, super cautious about it because I tell people then your legs can look like they have hail damage. So got to be a little cautious about that. What some of the cellulite treatments have done in the past, and there's been a limited amount of really good ones, is you're trying to treat those septi that are pulling that skin down, and that's what's going to get help smooth out that butt, those thighs. But we also can't confuse the true cellulite with skin laxity, and I think sometimes people confuse those two because no treatment for cellulite is going to treat skin laxity. That means needs to be another treatment. As you can tell, we're just endless amounts of treatments here. But
Yeah.
trying to find something in the past in our practice, we've done something called Selfina, which I think works relatively well, but it is more of a invasive procedure in that there's a suction cup, a little blade that goes in and breaks up some of the adhesions and keeps them from being able to pull that skin down. The really cool thing about
Yeah.
this new product is
And that's why I'm so excited about this product is it's minimally invasive. It's an injectable product. So basically, you're targeting the cellulite areas and injecting this product into that area, and the product itself is breaking up that septi, those little tethers that create the cellulite appearance.
The
And,
bands.
and remember again, this doesn't treat skin laxity. If you have a ton of really deep dimples, you can't think that one little magic shot is going to completely smooth out that butt and make you look like a little baby's butt smooth. But a lot of times people see improvement. But sometimes people in the studies needed multiple treatments to truly get their best result. But I think for people that just have a few little dimples who don't want to undergo surgery procedures, I think this is going to be a great alternative. So I'm super excited about this because for me, in a world where I do a lot of BBLs and butts, you just hate to have this great shape and butt, and then people are still a little self conscious about some of the cellulite on that butt. So
It, it
exciting.
is this something that we may be able to bring into the operating room and offer at the same time those patients are asleep?
I definitely think you could combine it in the operating room at the same time if people are getting a different procedure or something. I probably wouldn't do it at the same time as a fat transfer
Sure.
per se, but there's also some other thoughts of pre-treating people, helping with expansion and stuff that I want to look at in the future. So
Very
Interesting.
cool.
so stuff
Yeah.
for us to look at.
Yeah.
What about recovery time from using Quo?
Tends to be pretty low because it's pretty minimally invasive. So it's going to fall into the same category as a lot of fillers. You got to be careful with a little bit of bruising, swelling, maybe a little discomfort at the injection site. But most people can get the procedure, go back to work that same day. I wouldn't if you got a bikini photo shoot or a speedo photo shoot for your website.
Sure.
Then
Right.
Sure.
I wouldn't do it the day before. But or just change the angles a little bit.
Yeah.
Maybe not
It's
picture
all
from
about the
behind, but
angles.
And,
yep,
and filters.
yeah, the filters.
So aside from someone who has more skin laxity, all that aside, who would be a good candidate for this?
Well,
You think?
the studies, the people that did best were people with about a moderate amount of cellulite. If you have a tremendous amount of cellulite, then that's sometimes very difficult because some of that skin's been tethered for so long. There's a limit that you can get out. I think too, also being realistic that improvement is based on those dimples being less deep, becoming more shallow, being a little bit smoother, so there's less shadows of that. So I think those things are going to be super helpful. So I think, this is where your provider is going to help get you some realistic expectations of what you can get. Also, most of the studies showed that people needed multiple treatments. So something just to keep in the back of your mind. You can't think that you're going to come in, get injected the next day. You got this perfect baby butt.
Right.
Yep.
Yeah. Good. Yeah. I'm super excited about this product, and I look forward to hearing about your training and what your thoughts are on it.
Oh, I'm excited.
Yeah. Well, should we talk about some fillers?
Yeah, let's keep moving.
All
Keep
right.
moving. I love
like
it.
Rolling.
I like it. So, a new filler company to the market, Revance Therapeutics, recently released a series of fillers into the U.S. market. It was available overseas prior to coming to the U.S. market, and I think this is going to be a game changer for a lot of people because the technology that they're using in their fillers is really impressive. not to get too much into the science of it, but essentially, their claim to fame is that one, it lasts longer than the average dermal filler, and two, it moves with the tissue. So there's a lot of flexibility, stretchability with the product itself. So it makes things look much more natural.
Just so people don't get confused, it's not new. Like the company just popped up last month, and then now they're here. I mean, some of this has been in the works for 4, 5, 6 years. So it still went through all the FDA approval, still went through all the process of making sure that this is perfect. So just don't want people to get confused,
Yeah.
thinking that this is like, oh, boom, we're here.
Yeah. And what's interesting about this product, I'm sorry.
No, go ahead.
What's interesting about this product
It's a
is
show. Don't interrupt the flow.
Jeez.
is that it was created by a woman for women. A woman
Who
by the
actually
name
has an association with another company in the past.
Yeah, her name is Madame Valerie Topin. She was one of the co-creators of Juvederm.
Cool.
So she used to be with Allergan. So I thought that was pretty interesting.
Yeah, I was just going to say it's interesting. When I'm looking at companies to invest in, I like pharmaceutical companies and healthcare stocks. And when I'm looking at these companies, I'll always read write-ups like this new company is out on the market, and I'm like, I look them up, I'm like they were founded in 2010. They're just bringing something to the market because it takes 10 years sometimes for FDA clearance and all the studies that go into it and stuff. It's just illustrates Johnny's point. I think it's super fascinating how long it takes and the longevity of these companies just to get a product to market.
Yeah.
And sometimes people ask why there's products available in Europe or other countries instead of the U.S. And sometimes it's frustrating when you want stuff, but on the flip side, it's really done for people's protection. The FDA is very, very strict about what they let come, what has to be approved. And the idea is really just to protect people, especially when it's something like this that people always ask, what do I need? I was like, you don't need anything that I offer. We would like the stuff that we offer in our office, but making sure that safety is an utmost importance. And so that's why sometimes there's the lag, is making sure that everything's perfect so they can follow people out for a period of time. And make sure. Do you want to catch us up? Please, no, go ahead. Please, Tall Gamer. Yeah.
Thank you. So with this new filler, is there any additional training that would go into your daily routine? And then is there anything new that you can do with this filler that you couldn't do with the past stuff that you used?
I mean, anyone who's trained to perform these procedures should have no trouble, incorporating these into their practice. I mean, it's a pretty similar product to what's out there already. It's just that they have made some, I guess, quote unquote, advances in their technology as far as stretchability, the way that it moves with the tissue versus some older products that were a little bit more static. So it's made primarily for dynamic lines and wrinkles is what they're quoted as.
And all the companies have training things, and it's just kind of adding into your repertoire. I think COVID has forced everybody to evolve, and a lot of the trainings are online video stuff, because the days again of having 200 people in a room together going over this, scattered from all over the country, just probably isn't a great idea for at least a few more months.
Yeah.
So there's been challenges, but most of the places have found ways to innovate and keep people educated, for sure.
Anything new that you can do with it, though? Like, is there any new areas of the body that you can use it
I think
in? Or
new is a little bit of a difficult statement for these type of products, right? Because there's the stuff in terms of because every area of the body that you can use that the product can stay has to be part of that FDA evaluation. So there's things that these products can be used off label, is what it's referred to, in different areas, and that's done already pretty commonly. In terms of new stuff, there's new stuff in terms of the look, the aesthetic goals you can achieve, and those type of stuff. But it's not like it's changing. It's not an entire different category of product stuff, and that's part of what makes it safe. It's just trying to improve on what's out there, and some of that is adding the longevity to it, because most people love it. They just hate having to come back.
Sure.
I think the idea is that you don't want people to look overly stiff. So some of the movement and some of the new fillers has been to give them a little bit more mobility so that you don't look so stiff. So if you're talking moving, the product has a little bit of give to move with you instead of a harder, stiffer look. So I think a lot of these changes are a little bit more subtle. It's not like a completely different new product.
Right.
G.
No, I agree. I think, to kind of piggyback on what you just said and to kind of help answer Donald's question, I think a lot of that too falls in the hands of the injector and their skill level. Um, so, as far as like new and innovative things, I can't, I can't say that there's anything new or different that you can do with this product that you couldn't do with, any other dermal filler that's on the market. It's just like Dr. Franco said, just more the longevity. And I think that's going to be a huge selling point for this particular line of dermal fillers.
Okay.
Yeah.
All right, cool.
What else? What else is out there?
Revance also has in the works. It has not yet been FDA approved.
Probably. I'm excited about Quo because I do a lot of butt stuff, as we've talked about multiple times on
In the
here.
OR.
But this next one is
What?
probably the most exciting release of 2021.
Yeah, I think it is. Well, I think once it gets approved by the FDA and we can talk a little bit more about it openly, I think it's going to be a huge game changer. But we're talking about a new neurotoxin called daxibotulinum toxin A.
Say that one more time.
Daxibotulinum toxin A.
Gotcha.
Yeah. And Daxi is a long-acting neurotoxin, where most neurotoxins that are available on the market, like Botox and Dysport, Xeomin, Jeuveau, they typically have a life of about 3 to 4 months in the tissue where it's active and working. This one is been studied to work for up to 6 months. So I think it's going to be huge.
If you think about that, doubling the time, and then kind of puts people in a better rotation of coming in when they need for their fillers and so forth. So they're not making that extra step in between. So I think that's going to be a huge game changer. And I honestly think that's been a big roadblock for a lot of people who just haven't wanted to do it because they just kind of felt like the frequency was a little too much just from their life and schedule and so forth. So I think it's going to be a great one. Most of the FDA, just so people don't get nervous, a lot of the FDA lag here has been they've been a little busy with something called COVID. Two,
What is that?
two, there's been some travel restrictions in terms of some of the evaluations and so forth. So that's a few things that have delayed this, but it's expected hopefully here in the spring at some point. So I think that's going to be exciting. You're going to see that all over the news, and that'll be a big one for sure.
Yeah, I think that's exactly what happened with this product is, COVID restricted travel. So the FDA wasn't able to go and do a site evaluation where the product is being made. So I think once, things start opening up a little bit more and they can get that FDA approval, we'll see this on the market very, very soon.
Yeah.
Yeah.
It'd be exciting. Obviously, we haven't had the opportunity to use it yet, but something I definitely would try because anything that we can make things better for our patients, keep them happier longer, I think is exciting.
Yeah, it's hard for patients to come into the office sometimes. They got busy lives and work, and then sometimes it's hard to, get away from family and work, responsibilities and stuff. So we can do that and, save them some time. I think it'd be great.
I mean, the nice thing about this too is it typically takes about 6 months to get in to see, Austin's Most Beautiful Man. So then now you don't feel like you're going 3 or 4 months without, your Botox. And so now it fits into his schedule and your schedule all at the same time. So that's kind of perfect.
Yeah, it works out wonderfully.
Boom, boom, boom. You're welcome.
What if they're trying to get to see you more than once?
I mean, I can try to, squeeze patients in. I always do. Should we move on to some other exciting stuff?
Yeah. I always want to hear some exciting stuff.
All right. So, like I mentioned, I reached out to some of my friends and sources in these different aesthetic companies, and Galderma has some really interesting stuff coming out in 2021, as well as some stuff that was released in 2020 that we've touched on in the past, but I kind of wanted to bring up again, just because I think it's impressive with what they've been able to do with their product line. Product that was released in summer of 2020 is called Kiss, Restylane Kiss. It quickly became one of the most popular, if not the most popular, lip filler in that short period of time. The technology that they use in this filler is somewhat similar to what we were talking about earlier with stretchability and movement. They call it expression technology. But the interesting thing about this product is that it has both the stretchability property as well as giving the patient's lips, substantial amount of potential for volume. So you get the fullness with the movement, and so I think that's pretty amazing stuff. And it's one of the more popular products that I use in my practice, especially when I'm injecting lips. Dr. Franco?
And it was designed specifically for lips,
Yeah.
which was kind of really cool. And it just shows you, and obviously, people get great results with a lot of products. I mean, Juvederm Ultra Plus is still a workhorse, great product for lips and other things like this. But it's just nice because, sort of like we've talked about in other casts where implants have had such a variety and choices to get people their aesthetic goals, this is where going to a trained provider really helps you, because they can help guide you throughout this process. And by listening to you in terms of what you're looking for, what your goals are, they can really kind of help lead you to which product is gonna get you closest to that. And sometimes they can say, hey, look, I get that wish picture, but that didn't happen overnight.
Right.
Sometimes we gotta stretch these lips out. Sometimes we gotta do some other things to get you into a good spot.
Yeah. Additionally, they have a new product coming out in summer of 2021 called Restylane Contour. It is their second face filler, second option mid-face filler. It's primarily going to be kind of pushed more for like softer, thinner skin to kind of help with volumizing softer, thinner skin, but mainly for mid-face, cheeks and mid-face, which I think is pretty interesting.
I do have a question back on the Restylane Kiss.
Mhm.
So if I remember correctly, Johnny, you were saying that when it comes to the lips, because we talk and that area is moving so much, that typically fillers tend to expire faster in that area. Is the Restylane Kiss, does that have a longer life
So,
than more?
my experience has been yes to a degree, because of that expression technology,
Mhm.
because it moves. In terms of how much longer, it varies from person to person. Everybody, breaks down these products at different rates depending on their level of activity, metabolism, things of that nature. So it's hard for me to, give a definitive timeline, but I usually give patients a bit of a range.
And remember, it's in context because there's a lot of products out there. And so there's things that last 6 months all the way up to a year and a half. Some of the new HAs are somewhere in that 15-month range. So it's hard to say, whether it lasts longer, but definitely there's some new options out there.
Yeah. In terms of new indications with Galderma, Restylane Define, which is another one of their dermal filler products, recently got approved for the use of chin augmentation. It was FDA approved, so now it has an indication for chin augmentation, which helps with not only augmentation but profile balancing, which I think has become a really popular thing. At least in social media, and I'm sure you're seeing it in your practice as well.
Oh, yeah.
And we don't want to confuse people. Remember, just because somebody gets a product gets an FDA indication, when it goes on the box, it can only state whatever the studies were that got approved. And so if you want to add something to that label, you got to go through the whole gamut to be able to add it. So it's not an easy process. And just because you may have gotten it in those areas doesn't mean there was anything wrong with it. Again, it's at the discretion of your trained provider to be able to use the product safely in inappropriate areas.
Right. I'm not trying to mislead anybody. I'm just, going based off of the information that was shared with me. So,
You're not trying to catfish them like some of your Tinder pictures.
no.
Yeah.
I'm kidding.
Well, I mean, those
That's-
got taken down since
Oh,
Mama
since
Gilbert,
Mom-
yeah,
kind of
that's
cleaned,
right.
I know.
cleaned that
Provides
up,
the,
streamlined it a little
yeah.
bit. There's a few emojis on there. It looks good. It looks good. I saw it. It's good.
I don't have an 8-pack. I really don't. It's getting there though. Should we move on? I don't.
Yeah,
I feel like we're. I don't want to feel like we're running out of time because I just got so much to talk about.
Yeah. Give us some more highlights.
I love it.
Let's see. Sculptra. which we've talked about in previous podcasts as well, is going to be getting a new indication towards the end of this year to be used in the body. So it's currently being used off-label, like we've talked about. A lot of these products are, but it's they're working on getting FDA approval for Sculptra to be used for butt augmentation. Is one of the main areas that they're going to be using it. I don't know if do you use any Sculptra in your practice?
I do, so we use it for hip, butt stuff. I always try and make sure people are super real about what you're going to get from this, and hopefully these indications will help guide people a little bit more, because a lot of times when I give talks and so forth, it's trying to make people be super real about what you can and can't do with some of these products. So I think that'll be a good guide for patients.
Yeah, I think it'll be really helpful. Restylane L, which is one of the original Restylane products in their product line, is currently being studied for approval to be used in tear troughs. I mentioned this a couple podcast episodes ago when we had Dr. Khan on. It's one of my favorite products to use in tear troughs. So it's already being used there, but again, this is just getting that official FDA approval. And I think the goal is to have that approval by the end of 2021, maybe early 2022.
Cool.
Yeah.
Very cool.
Let's move on to some Allergan stuff.
Yeah, let's do it.
Company by AbbVie. Recently, Allergan was acquired by AbbVie. With this acquisition, they have just gained a lot of potential to bring more things to market because they were just, they basically just got a lot of help to, do a lot of more R&D and bring more products to market. So I think that's really impressive. They have a somewhat similar approach to their fillers. It's called Vicross technology. Again, it's a way of producing the hyaluronic acid that allows for a little bit more stretchability, like we've been talking about. That seems to be a trend that's been pretty popular for the last few years. They're hoping to bring out new indications and new products on a yearly basis moving forward because of all this financial help that they're getting from AbbVie. So that's going to be really, I think, what's the word I'm looking for here? Interesting, I guess, because the filler market, the aesthetic market is changing, so quickly. So many advances are being made. So for someone to say, we plan to, just, push the envelope and keep bringing stuff out to the market, I think it's going to be really exciting for people that, use these products on a regular basis.
I think that's where we're at in healthcare, just in general overall right now. Nobody's satisfied with status quo. All these companies continue to try to push the envelope with new technology, new products, new ways to utilize those products, and even subtle changes like you're talking about, changing, some of these HA fillers to where they are more mobile in the tissue and not going to leave people with that frozen, Beverly Hills 70-year-old woman from 20 years ago look. But I think that's where the, medicine in the future of our sector is kind of going in general.
Yeah.
And I think this is going to be challenging, right, for providers to keep up with all these new changes. I think sometimes it can be confusing for patients to know what's best for them. And so it'll be interesting how everything plays out, because I think some products may go by the wayside as new things come out too.
Yeah.
So I think the next 4 or 5 years are going to be really exciting.
Yeah. They have a few products that are currently only available overseas that are going to be coming to the U.S. market. I don't have any release dates as of now, but it's pretty exciting stuff. There's one product that they have overseas called Juvederm Velux that they're planning on bringing at some point in the near future. That's going to be mainly for areas like the jawline and the chin, where we want to create more structure and give more of an augmented look, more of a defined look, a sharp look. So that's pretty interesting. They have another product overseas called Juvederm Velux, which is meant primarily for improving skin texture and quality. So it's going to be a little bit more of a thinner, more superficial type of filler to help with like texture changes, which I think is pretty interesting. Again, these are only overseas at the moment, so I don't have a lot of information on it. But I'm excited to see what they when they bring this to market.
And then sort of like Restylane, it seems like Allergan is doing a lot of expanding of their FDA indications for a lot of the procedures. We won't make people listen to every laundry list of item, but you probably got about 6 or 7
I know.
new pending areas.
I was really excited.
No, I think it's exciting. I think from a patient standpoint, it just shows and it validates, some of the stuff their providers have been doing. Like, hey, look, this is safe. This is a good idea. This is something that there's obviously a need, or the companies wouldn't spend so much time, resources, and money, getting them approved stuff. So
wait, that's not
I think
free
it's
to do an extra FDA approval for? It is super expensive for these companies, and if they didn't realize that it was valuable to them, they wouldn't be making those moves.
Yeah.
What about anything else on the filler Botox? Because I don't want to skip out. You got a few devices here that I think is a little exciting too.
I was going to ask you to maybe give us your thoughts on these new devices. In terms of the filler and Botox, there's some additional indications that are currently being worked on through the Allergan Juvederm line. They were recently approved or last year they were approved for use of Voluma in the chin. Some other stuff that just doesn't have the official FDA indication yet, but I think it's exciting stuff to come. But yeah, I was going to ask you if you could maybe give us your thoughts on some of these other devices that are being used in aesthetics for body contouring.
Yeah, I think the kind of 2 big ones that just came out at the end of last year, and one came out, just got released a couple of weeks ago. So M-Sculpt, which we've talked about before, which is a muscle building, came out with what's called now M-Sculpt Neo. Which is basically what a lot of the devices are going to now is being able to serve more than one function. Because again, it's sort of like we want in our Botox to last longer. We want to get the most bang for our buck if we're in the office. So if somebody's getting a treatment, with the M-Sculpt Neo, you can do stuff where you can do some radio frequency, which you've seen us do with the J-Plasma and other stuff, can do some skin tightening. And then you can also do the traditional M-Sculpt with muscle building. So that's kind of a neat little nugget how they've kind of wrapped this into one device where it can do multiple things. So I think that's nice for providers who there's just a limit to amount of devices that you can have in your office. And the more kind of tools and stuff they have that you can offer to patients, the better. The more things patients can do in one setting, the better bang for their time, because we're all busy, we're all running around, we're all doing things, and so you don't want to have to come in 16,000 times at 16 different appointments to get the results that we want. So I think that's super exciting. We'll have to follow the results of that, but should be a nice little tweak for people. Allergan, again, not to be left behind there. They've made some improvements. Coolsculpting, which has been a crowd favorite, I think, for years and years, to actually developed in Florida, has been super popular. And people who don't want surgery, didn't want liposculpting, maybe just want a little tweaking, and had been a nice alternative for them, and they've combined this, and so they got their Coolsculpting Elite, which is basically combining their Cool Tone, and which is their version of the M-Sculpt in terms of a muscle building. I know the M-Sculpt people would be pretty upset if they're listening and me saying that they're similar, but it is another muscle building device, and so they've combined them again, with the idea of being able to remove fat and build muscle in one. Is anyone who works out, Celebrity, if you follow him, he works out occasionally. Tall Gamer claims he does, but when I crushed him in our push-up contest, it was clear that it was overhyped, if you will,
before the snowstorm.
But so obviously, if you can reduce fat and build muscle, those results are going to be much better, which just makes sense. So I think some of these devices that can do multiple things are going to become super popular over the next several years, because it's just being able to treat all these demands just like the products are doing. I think patients have become more savvy. I think they're demanding more. I think as providers, we really want people to be able to get a good bang for their buck. I think we want to be able to show them results. And so, some of the problems with lasers and some of these minimally invasive devices in the past was the results were minimally as well. And so, and that's a frustration when people are spending a lot of good hard-earned money, and we want to make sure that if we're recommending something that give you the best chance to be happy with it.
Yeah.
I also think, you touched on it before. Patients' time is valuable, just like a practitioner's time is. But these patients' time being so valuable, if they only have, 1 hour of time blocked off to come to the office, and they can get, they can come in and get M-Sculpt, but now they can get M-Sculpt Neo and have some fat burning and toning at the same time that they're getting some muscle building. It's two birds with one stone.
Yeah.
With all of these different tools that we've talked about just in this one episode, right? That's so many additional tools. How do you, as practitioners, choose which tools you want to incorporate into your practice? Like, because
That's always a chronic question, and that's a really tough one that I think you ask every provider, get a different answer. But
Yeah.
I think it's got to make sense for your practice. Something can be a great device and just not fit into your practice, and so I think that's a big one. I think making sure that it's something that you're going to recommend. I always tell people I wouldn't recommend something I wouldn't do. So
Yeah.
if it's not
Something you have faith in.
Mm-hmm.
Yeah.
Gia, what about you when you're thinking about trying a new product or doing something?
I think for me, it comes down to, the consultation, trying to assess the patient's goals and trying to match their goals with what I have in my toolbox as closely as possible so that we can both be happy. Because, if the patient isn't happy with their result, you're going to know about it. And they're going to tell their friends, and so you want to try and make the patient as happy as possible and give them the end result that they want. It's like I think Vidal Sassoon says, if you don't look good, we don't look good. So
what about let's do a little we're running a little short on time because there's so many exciting things.
Yeah.
But let's get a little behind the bovie, but it sounds like we already touched base on that.
Kind of. So one of the things I wanted to mention is that some people may not know is that a lot of these products are available, and they've been around for a long, long time. They're just available overseas in Europe, in the Asian Pacific markets, and they've been around for a long time, being used, in all these different settings. But we don't see them for quite a while. And the other thing is that they sometimes have a bit of a name change when they come to the U.S. market. So I thought that was kind of interesting.
Sure.
From a patient safety standpoint, I think it's kind of nice sometimes to know that, like, hey, this, so many people have been treated with it and done well.
Right. Exactly. Yeah.
Do we get a quote of the day?
Yeah.
Yeah, I can give us one. This one I feel like kind of ties into what we were talking about today. This is from Stephen Jeffs, or Jeffs. I don't know. I think Jeffs. Innovation is the unrelenting drive to break the status quo and develop a new where few have dared to go.
I mean, that sounds
Nice.
pretty fitting today.
Yeah. I like
kinda
it.
rhymed.
Awesome.
like it.
Gilberto, you want to sum us up and take us home since this has been your episode?
Yeah, thank you. So, I think there's a lot of really great things to come in the aesthetic world. I think the future looks really, really bright. I'm super excited about all the stuff that's coming out and what things that will be coming in the future. 2021 looks to be like a great year for injectables and devices. I'm just really excited about 2022 and beyond.
And with providers like you, how can it not?
I'm just passionate about what I do, Travis.
Love it.
You want to sign us off?
Yeah. So thank you everybody for being with us today. We're Plastic Surgery Untold, the greatest podcast in the world, as voted by us. We look forward to seeing you on our next episode, where we'll have a couple of social media influencers talking about what their thoughts are in social media and aesthetics.
One of them will be my wife, at Your Trendy Therapist.
There it
you go.
is.
There's her plug.
There it is.
There's her plug.
That's what I was waiting
Making
for.
our debut.
Awesome.
Thank you guys so much. Really appreciate it. Thank you, Dr. Franco, for letting me take over today. I really appreciate it. It's been a humbling experience.
Awesome, guys. Appreciate it. See ya.
We'll see
See ya.